So since I've seen, a lot of things have changed. 100% confirmed, biopsy proven.
Mm-hmm.
HER2 new has come back positive, which is in your favor in that way. How is your weight?
It's stabilized now at 135, 136, so I
Not
think I've
losing
stopped.
anything.
I was a pretty muscly guy, so when I have a deficit of, now I'm eating at 12, 15, that's a big transition from the 25, 3,000 that I had before.
Okay, for Kevin Tenario, adding docetaxel to his regimen, first cycle he got only FOLFOX. How was the visit to, I think you saw 2 different doctors at least.
I saw Dr. George, and he would recommend immunotherapy, so he would be more aggressive since I'm younger.
Of
So
course.
was he able to talk to you at all?
Yeah, he did.
And then I saw a radiation oncologist. She was recommending radiation, I think it was after the chemotherapy cycles,
Right.
not to do them at the same time or
At the
something
same
like
time,
that.
right, yeah. 3 things in general: chemotherapy, radiation, surgery.
Mhm.
Is surgery possible? We keep looking at it, but usually not for stage 4.
Right.
So,
So just
that is on the
so I
back
am
burner for now.
stage 4.
Yes,
yeah?
confirmed.
Okay.
Biopsy that you had.
Yeah,
So
yeah.
from the right iliac core, polydifferentiated non-small cell carcinoma, morphologically consistent with patient's primary GE junction primary kind of thing. So that confirms, even though on the PET scan it shows, but we always want to make sure, yeah, that's what it is, and it's nothing
Mhm.
different or either different. The other thing is HER2 new, which is the fish. When I saw it, all those things were still pending, I think.
So
Came
now
back
it-
positive. So based on that, so what exactly you mean when you say immunotherapy?
What do I mean by that? Oh, I don't know. That's what
Okay.
Dr. George said.
Okay. Okay, so there are different options in that. So standard treatment is chemotherapy, number 1. Number 2, there is another drug called pembrolizumab that is being addressed nowadays. It's more so for people like melanoma, lung cancer, and things like that. But then some rare cases of GI cancer, meaning like this, sometimes you can use provided marker that we look at called MSI, microsatellite instability. So we do that, but not as a front line, meaning first line treatment later on. And then we always try to look at other options of any targeted agent-based treatment. And so we wanted to send all those testing, so that's called foundation one. So he was asking, we would recommend, well, I said, we already did that. Meaning it's pending and then it takes longer time. And that is like backup plans later on.
Mhm.
He was telling about he would recommend the same chemotherapy, and then by the time you went and saw it, the HER2 new, that's the marker or one of the targets that we see, was positive on the fish. So we would add a medicine called Herceptin, a protein, to the chemotherapy backbone, see if we get a good response, and then keep continuing. Until I know further, I started you with a regimen called FOLFOX, 5-FU and oxaliplatin. And once it is confirmed, biopsy proven, that it is stage 4, and then for younger patients, we also prepare a newer regimen called FLOT, so which is FOLFOX 5-FU, and then we add a third drug. It's a 3-drug recipe, well actually it's 4 3-drug recipe of chemotherapy, and that is docetaxel, and that's what he would recommend, which I agree. And until I know further, I wanted to get going, because
Yeah.
you were having so much trouble swallowing, and
It was,
And
yeah,
so I
only
wanted to get
liquids
going
only,
right
yeah.
away.
So the fact that I can eat cookies and saltine crackers, I mean, it's not an amazing improvement, but it's something that
better than a week,
Yeah.
before.
2 weeks before.
Soft,
Yeah.
like soft vegetables.
Soft
He can eat
Super like
like
soft stuff.
carrots, kale, as long as I cook it really tender.
Then,
Yeah, he can do. She can
Make
do
sure you
it.
chew it properly.
Yes, yes.
And I'm hoping as time goes by, it will get even better to the point that you, doc, I can eat normal food now.
Yeah.
And that's what I'm looking forward to.
Thank you.
Seeing as soon
Thank
as
you.
possible. So, and I'm going to add the third drug called docetaxel.
Throw it all in there.
Yes.
So,
Oh,
Throw it in there.
So,
I don't care. It's
tiredness, fatigue, low blood counts, tingling,
Yeah.
numbness. Docetaxel can sometimes cause swelling in your feet, and we give a dose of steroid before, the dose of steroid after sometimes when we do it by self. But anyway, you're going to get IV today. People tend to see a little bit better response when we add the third drug
Yeah, sure.
in
Yeah.
some patients, and you have nothing to lose. And
Yes.
I would say
Throw it in there.
we need
Yeah.
to be as aggressive as possible.
yeah.
And to that we add Herceptin, which is a protein.
Mhm.
So Herceptin works against HER2 new, it's a target in the growth cells, and if it is present, then only we give a medicine called Herceptin. So it's not present in all people. So in your case, in your cancer, it was present. We add that drug and it tends to improve the outcomes even better.
Oh,
Okay.
okay, that's good.
I mean, we still cannot cure it, but at least we want to get a response to see as much as possible. And then we keep adjusting the doses of the drugs depending on how your numbers are doing, and so we keep watching. Now, you had an echocardiogram.
Yes.
Yes.
Okay, that is to see how good the heart function is. We expect yours to be normal, but at any token, we would like to have a baseline,
Okay, yes.
because Herceptin is a protein very rarely can affect the pumping action of the heart,
Okay.
called ejection fraction,
Mhm.
efficiency of the heart. While they receive Herceptin every 3 months on an average, we try to see how the heart function is doing,
Okay,
and so that we don't compromise heart failure and things like that. It's
okay.
not common, but we kind of watch that.
Mhm.
And we keep giving Herceptin as long as you can tolerate. There's no end date,
Okay.
meaning you give only 3 months or 6 months, nothing like that.
Okay.
Herceptin is one of the key medicines in people who have metastatic esophageal cancer, who have HER2 overexpressed on their cancer, so we should have. At some point, we'll stop chemotherapy and continue only Herceptin to minimize the side effects. So there are various ways of doing it. And then at some point, if chemotherapy is not helping, then we look for immunotherapy and things like that. So we like to keep all the options open in that way.
Oh,
So right now, let's continue the chemotherapy, but I'm going to add a third drug, number one, and the fourth drug is the protein.
Okay.
So third drug is the chemotherapy, the fourth drug is the protein. Usually that doesn't have any major side effects except the heart function that we are talking about. Side effects of chemotherapy you already had, you already know, but then it can be a little bit more with the addition of the third drug.
That's fine.
okay.
And then you lose hair.
Okay.
The chemotherapy that I've given you usually doesn't cost, but the third drug that I'm going to add will make you lose hair.
That's why I cut it
So,
off.
and we watch liver function, kidney function, like, just like any other chemotherapy drug. And the chemotherapy is still every 2 weeks on an average.
So how long will I be on chemotherapy for?
Right, so,
How many cycles am I doing?
right, let's say 8 cycles, this flat regimen is given 8 cycles, well, you already had 1, but without the third drug called docetaxel. We keep watching like every 3 months on an average, a
Okay.
CT scan.
Okay.
Number one. Number two, symptoms, like are you able to eat better? And then we would like to give a break from chemo after the, let's say on an average 8 cycles.
So that means I
each
have 7 cycles.
So,
Or
yeah,
you're saying-
give or take.
Okay.
So 7 more to go.
So
No,
after
it's gonna be
today,
8.
approximately. And it depends how they tolerate, and
Okay.
it depends how they do. And then, assuming that you have the best response and the scan looks good and you're feeling good, I would like to take a break from chemo
Okay.
and give only Herceptin, the protein
Yeah,
alone.
okay,
Mhm.
okay.
And that, if you're doing that, the protein, the advantage of protein is it doesn't have to be given every 2 weeks, you can make it 3 weeks also.
Okay.
So we'll go along and we'll adjust as we go along.
Okay.
So for timing, let's say 8 cycles plus minus, depending on how your response
Okay.
is. And then I may have to keep adjusting the medication doses.
So
And
I
don't
would,
have
I
to
would bleed into May too, yeah?
Yeah, let's say
About May.
8 cycles, let's say it's end of June, or maybe mid-July, something like that.
Okay.
If we
Okay.
delay it or something.
Just so I can get the planning.
Rough idea.
Yeah.
Right.
And then after that, let's see if we can hold off on chemo and continue only Herceptin, which will be like every 3 weeks.
Okay.
Okay, okay.
So the treatment plan has changed, so more chemo, and then is surgery on the board, or is that off now?
Off for now.
So it's off for now until we see any
Any
How
progress,
response.
yeah.
Surgery, usually when you have extensive disease in other places, by doing this will not help you.
Right.
But unless there is some other reason to do the surgery or something. So for now, yes, off. Radiation.
Radiation
Okay,
is also
okay.
off.
Radiation is later on, depending on how the response is.
Yeah,
If we
that's
need to, then they go and radiate that part.
Okay.
But for now, we'll watch.
And immunotherapy will be later.
The
also.
immunotherapy for is more for future.
Okay.
Okay, okay.
Okay, so not right now, like Dr. Drew is
Mhm.
suggesting. Okay.
Correct.
Yeah.
Do you know the statistical likelihood of me getting cancer and this type at this age?
Oh, wow, very rare.
I know, right? I just want to know.
I don't know the numbers as such.
Is that
Did
something?
you find out?
No, I wasn't
I've
able
never
to find
seen
out from
anyone this
anyone.
young with the esophageal cancer stage 4.
I want to figure out the number. Is there a way you can find that out by any
We'll
chance?
try. I don't know, I need to look at the literature and find out. But so, and this chemo also, maybe there is slight change as to how long it will be given and all those things. So let me tell you, and so you'll get docetaxel today and oxaliplatin also today, and then this is probably for 24 hours. So whenever a cancer spreads to the bone,
So is it in or is it on top?
inside the bone,
It's inside.
inside.
Oh,
And also on the PET
God.
scan, remember there are some lymph nodes in the back.
Ah!
So all those things. So remember the word osteoporosis?
Yes.
Probably mom will know. So osteoporosis is weakening of the bone.
Uh-huh.
Okay.
Usually people more
Old,
than 50, 60,
yeah.
70 kind of thing.
Old
can have
people.
more so in ladies compared to men and all those things. What happens in osteoporosis is they are easy to crack, fracture.
Yeah.
So we recommend exercise, maintaining healthy weight, calcium, vitamin E, those kind of things. Same thing can happen in people who have cancer that goes to the bone. So makes their bones weaker,
Right.
pain
Mhm.
related. So we give a bone hardener. So we expect your bones to be strong, but still because of the cancer spreading to the bone, we recommend we give a bone hardener in your case to minimize the bone-related complications of a cancer,
Okay.
whether it's lung cancer or breast cancer or any esophageal cancer or stomach cancer. So we know that your cancer has spread to the bone, so we would recommend that bone hardener also, like usually once a month for some time. And then after about 3 months of treatment or so,
Okay.
approximately.
Okay.
So that means we are talking about 6 cycles, right?
Okay.
So
Okay.
let's repeat the scan and then go
After 6.
approximately,
Yeah.
give or take 3 months, 2 to 3 months, unless things have changed. Before quote unquote number 7, let's say.
Yeah. Yeah.
Notice we don't. Yes,
We're approved.
perfect.
All right.
And pharmacy has enough drugs, so we're good
Yes.
to go.
Yeah,
Thank
and then
you. Thank
I'll
you.
put in an order for Zometa
Okay,
next time.
okay,
Not
okay.
today, but I don't want everything at the same time.
And then I'll get the dexamethasone brought up for,
Yeah.
that's for today.
For
From the
today.
pharmacy downstairs.
Yeah,
So then
and
we
then
can
next time
discuss-
onwards, you can take it the
Yeah.
day before if you need to.
I will send that in.
So Zometa is a bone hardener, the IV thing, and that usually doesn't have any major side effects, but sometimes we watch for dental issues. You don't have any active dental problems, correct?
TMJ.
How
Like,
bad is it?
I've been wearing like a mouth guard every night.
Okay.
That helps.
Usually that's not a problem. Jaw problems, with depth of the jawbone, it's called necrosis. Usually that happens less than 5% or so, and that too after 2 years. So are you using any pain medicine at all, Kevin?
No.
So I want you to be as functional as possible. Don't do heavy lifting, but try to be as active as you can be, which you're already on.
So no heavy lifting.
You can
How
do
much
walking.
heavy you want?
Can I do a pull-up? 136 pounds. Because I'm pulling my own body.
Right. Wait for another month or so.
Wait another month or so?
Yeah, we'll see the
So
blood
how
first.
much weight can I pick up with one hand?
Yeah,
Let it
settle
heal
first.
first, settle down.
He's
I'm
used
used
to
to
gym.
picking up hundreds of pounds and now... when he checks the biopsy, can you guys
Yes.
just let him G stay?
And I'll
Yes.
tell you all about it when I see you again. We've come a long way from where we began, and I'll tell you all